Welcome to Talking Points. My name is Dr. Stephen E. Gardner, and we have been doing this series on the trauma of transition. And we have been really going in to really try to understand why it's difficult for some people to transition when they all hear the same word, or they all receive the same teaching, or they hear the same truth, whether it be a teaching or just a truth. And some people have difficulty in making that transition to a new paradigm or a new way of doing things. We want to talk about that. And some of that has to do with trauma. Some people, in trying to get them to move from where they are, to move to a better place, they can be re-traumatized. And so there's also this struggle, even on a personal level, that people engage in that's very real. Remember, in the teachings of the Apostle Paul, he's talked about how that he desired to do one thing, yet there was this other thing there with him that gave him an issue, that gave him a struggle. And so basically what we're talking about here is trying to understand why that is. Why is the struggle so real? Why is there trauma associated with transitioning from the old to the new? So we're going to look at that. And so let's delve right into it, and let's see what we can learn and what we can glean on that's going to really help us. The struggle is real. The trauma of transition, part 3. What every leader needs to know. Some of you lead in different ways. You don't have to necessarily pastor a church. You might run a business, or you might be part of a nonprofit, or you might be in some sort of other secondary or middle level. And you may encounter some aspects of transition, especially in a business, when a new way of doing things comes into play. People have a tendency, I'm not ready for this new thing. I like the way things were. I like the way things have always been. That is a type of trauma. And that can be more traumatic when there are a lot of things that are introduced that have to be changed or that have to be adjusted. A lot of times what we learn is that even as leaders, when we are working with people that are transitioning, we have to be sensitive to the fact that there might be trauma that's associated with it. And we have to reframe how we look at things so that we can help them make the necessary moves, as it were. Now, this is not always the case, but the point is in this series is to be able to unpack what the trauma of transition looks like. The last time we took a deeper dive on what we can learn for our present context regarding those who struggle with the trauma of transition. We also learned that one size doesn't fit all when it comes to addressing a group of people, especially those who are transitioning from an old life to a new life. One size doesn't fit all. Everyone's process is different, and before we can help them, this has to be understood and respected. A lot of times what we run into is that is this cookie cutter approach to leadership. This cookie cutter approach to maybe some sort of paradigmic shift that might be occurring within your organization, or might be occurring with, even for those who are pastors, occurring within your church or your church movement, as it were. Everyone's process is different. And before we can help them, this has to be understood and respected. This cookie cutter approach does not work for everybody, does not work for every group. And so what is it that makes some, move on and transition with the times and transition with the new norm, as it were. And why is it that there's always a faction that seems to be more wedded to the way things were than to what's being suggested or what's being offered, or in this case, what is really necessary in order for the good of all? Jesus made it clear in the parable of the wineskin that when the taste of the old is still in their mouth, people are not ready to transition to something new. We talked about that parable. Jesus gave, you can't put new wine in old bottles, but new wine must be put into a brand new wineskin. And because we learned that in the wineskin industry, if you want to put it that way, is that once new wine's put into a wineskin, which is usually some animal skin, it expands. And once it gets to its full expanse, then it has to be recycled. You cannot put new wine into a fully expanded wineskin. In many cases, that's what's happening. You can see that where people are trying to put the new in something that is old, and it just doesn't fit. It just doesn't work. And what happens, it's another trauma. A trauma is caused because what? It bursts and it's spilled. And the outcome of it is not in the best interest of the individual or the best interest of the leader or the best interest of the group. But Jesus made it clear, even when he identified, the necessity of taking a new wine and that it has to be put in new wineskins. It has to be put into a new container, as it were. It has to be put into a recycled or refurbished context of humanity. Obviously, we cannot throw out our old humanity, but we can recycle our humanity. Now think about this. This is what Paul was alluding to in Romans 12. And we don't really talk about it in the terms of recycling. He says, be transformed by the renewing of your mind. Be transformed by the renewing of your mind. In other words, you don't throw away the old mind, you transform the existing mind. You basically refurbish and you recycle it with another set of truths. Well, what Jesus was making clear in this parable, he was saying that when the taste of the old is still in their mouth, people are not ready to transition to something new. After all that Jesus said, he said, look, people are not going to be warm and fuzzy to anything that's new, because why? I'm more wedded to the old. I relish the way things were. I like the way things have been. And that's what the trauma of transition is all about. And that's why the struggle many times is so very real. Well, today I want to do a deeper dive. I want to begin to talk about the attachment theory. Now, I've included within this particular series some research, and research that may help us to understand why people are attached, why they don't move very quickly to something different, why they would rather have things a certain way, and in many cases will dumb down or either not dumb down, but either dig in or just simply refute anything that resembles change or anything that they have to give up from what they are currently being introduced to. So the attachment theory was developed by this gentleman by the name of Edward John Muston Bowlby. And those of you that know anything about have studied psychology or anything, or maybe stumbled on this course in college, will know that Bowlby, he was a British psychologist and psychoanalyst, notable for his interest in child development and his pioneering work in attachment theory. Bowlby was the first to articulate the relevance of attachment theory to mourning, to loss, and separation. Now let's talk about mourning, loss, and separation. Some people begin to mourn what they no longer have available to them. Obviously, when we've lost a loved one, there's a period of time that we go through in terms of mourning. The idea of mourning, though, everyone goes through it at one time or another. We don't always remain in mourning, but at some point we begin to heal and move on. So when Jesus said, no one having drunk old wine immediately desires new, they may still mourn for the old. They may still long for what they used to have, but in the process of time, they will move to embrace a new concept and a new idea. But mourning is part of this attachment theory. Mourning, loss, and separation are part of it. In fact, the framework of attachment theory, as it relates to mourning, enabled him, which is Bowlby, to explain the experiences, symptoms, behavior, pain, and purposes of grief and mourning in individuals. Yes, sometimes change can be very painful. That's part of the trauma of transition. I don't really want to change. I am not ready to change. And as those who lead others, we have to understand that and respect it. And know that just some people are just not ready. And it's more to it than just them simply, or just resistant. There's something deeper, something at another level that really helps us to understand why people are so attached to the way things were. In fact, insights that undergird Bowlby's theory of mourning are this. Attachment behavior is conceived as any form of behavior that results in a person attaining or retaining, look at this word, proximity to some differentiated or preferred individual. Attaining or retaining proximity. They don't want to get too far from that person. They don't want to get too far from what the way things were. They don't want to get too far from that paradigm. They prefer that. And so it's behavior that is conceived as any form where the person is attached to a proximity to an individual or just a way of thought. The goal of attachment behavior is to what? Maintain certain degrees of proximity. So the goal of attachment behavior is active in making certain that you stay close to proximity, that you stay close to the way things were, do you stay close to the way things have been, or of communication with, this particular individual or group, or the discriminated attachment figure. Just some theoretical stuff to really understand as to why the trauma of transition is difficult for some, and others may struggle for a moment, but they move on. Some people struggle a lot and they don't move at all. C, whereas attachment bond endures, the various forms of attachment behavior that contribute to it are active only when activated by certain conditions, such as, I go along with this for a moment, then all of a sudden, after a while, wait a minute, things are not shaping up, things are not happening fast enough, things are not going according to what I had imagined, and so what happens? I want to go back. We've talked about that in talking about Lot's wife. We don't know what all the circumstances that pertain to Lot's wife and why she looked back. The fact is, she looked back after knowing they weren't supposed to. Activated by certain conditions. Sometimes it's curiosity, other times it's because There's something in them that longs for what was normal, longs for the portrait of the past. And the portrait of the past looked a certain way, which was very predictable. Now something is offered that's less predictable, something that I'm having problem trusting, something I'm having problem having faith in. And so the attachment bond begins to kick in, is activated to resist, is activated to try to encourage others not to move in that particular direction. D, many of the most intense emotions arise during the formation, maintenance, the disruption, and renewal of attachment relationships. Threat of loss arouses anxiety, and actual loss gives rise to sorrow, while each of these situations is likely to arouse anger. But such emotions are usually reflective of the state of a person's affectional bonds. So these attachment relationships, there's a formation, they're formed, they're maintained, and if they're disrupted, there is some sort of response, and the renewal of it also gives rise to this whole understanding, or this whole theory, as Bowlby explains it. Now, you may ask, what does this have to do with the trauma of transition? Well, it should be clear that sometimes experts who have observed this behavior can be informative when dealing with people or individuals who are trapped, and why. So we're allowing researchers and observers to explain why some people are trapped. Don't you know somebody that's trapped? Weren't you at some times trapped in a particular way of thinking? And here we're talking about a way of thinking that results in a type of behavior that also results in a type of action or inaction. This insight from Bowlby's theory of mourning, or Bowlby's attachment theory, can better inform leaders that what we're seeing sometimes is not just outright disobedience or resistance to change. It lies deeper and is explained by the attachment theory, where they actually mourn for the way things were. Now, I know in certain faith traditions, people are not doing what the pastor says to do. Things are imposed, or things are projected onto that group as if their disobedience is a form of witchcraft, or they are of a Jezebel spirit. Now, you all heard these kind of stories where people project these images on the people that do not do what they are told to do, or they're not moving in the direction that they're supposed to move in. I personally believe that it is unfair to make those kind of assessments, to say this person has a Jezebel spirit or this person is operating in witchcraft, simply because this person won't do what I'm saying. Maybe there's something that lies deeper as to why they have resistance to it. As leaders, we need to figure out what that why is, and not always default to some knee-jerk reaction that places it in some negative context. Maybe there's something actually at play here that may require us to be a little bit more patient, that may require us to take some time to really hear, their side. If we always say it's like this and no other way, or don't give room for any kind of feedback, what happens is that you're going to get more resistance, and you're going to get people to react very negatively. Now, I know that what I just said is not going to go very good with people that have, projected these kind of things on people. Guess what? I did the same kind of projections, at times when people weren't actually doing what I had suggested, or the way I was directing things at that particular time. But as I matured and learned, I come to understand some people are trapped, and I need to be able to help the ram in the bush. I need to be able to help that sheep that's caught over there in the thicket while the 99 are able to move forward. Let me spend some time to really get a dialogue and to find out what the real issue is. By doing so, we can become better leaders, especially in times of change, in times of transition. So the insight we're talking about can better inform leaders that what we're seeing sometimes is not just outright disobedience or resistance to change. It lies deeper and is explained by the attachment theory, where they actually mourn for the way things were. Well, here's another concept and idea, and we probably heard of the Stockholm Syndrome. You can talk about people that, historical figures, the Patty Hearst, where the captor kind of, is more favorable. The captive is more favorable to the captor. Well, that's what the Stockholm Syndrome is all about. In fact, it is a condition in which hostages develop a psychological bond with their captors during captivity. They develop a psychological bond to their captors during captivity. Stockholm Syndrome results from a rather specific set of circumstances, namely the power imbalances contained in hostage-taking, kidnapping, and abusive relationships. Power imbalances, hostage-taking, kidnapping, and abusive relationships. So I mentioned Patty Hearst, but you can find the same type of thing happens with those who've been kidnapped. How many people you know that have been kidnapped? Maybe a child has been kidnapped at an early age and have been forced to live, with their captor. And when it comes time for maybe this person is found, they find out that this person has held this person captive all this long and taught them that this is your name now and grew up a different way. And then the real parents come along. Oh, we know stories like this. And that child has now, no, this is my parent. I don't know them. Why? Because that's a part of Stockholm Syndrome, is that something has happened to where now they become more psychologically bonded to their captor because of the length of time that they have had with their captor. We also see it in abusive relationships. We all have known people, or maybe we have had or have been in an abusive relationship to where we're not warm and fuzzy and ready to just throw their captor or throw the abuser under the bus because, oh, he or she still loves me. Something to think about. We find this Stockholm Syndrome even in abusive relationships. Stockholm Syndrome is a way of understanding the emotional response that some people have towards a captor or abuser. Sometimes people who are held prisoner or are subject to abuse can have feelings of sympathy or other positive feelings toward their captor. Notice that. They can have feelings of sympathy. I really feel sorry. Or positive feelings toward their captor. We see that a lot in cults. People have gotten into a cult to where, they have these positive feelings to someone that actually may use fear as a way to keep them, in play, to keep them in check. Sometimes this type of, this can happen over weeks, days, months, or years of captivity and close contact with the captor. So I want to shift here for a moment and let's talk about the spiritual Stockholm. Now, in our past, in the Bible, we have been talking here in the Bible in Numbers chapter 1, and not Numbers chapter 1, Numbers chapter 11. And we began to talk in verse 4 how that this particular group of people, the Israelites, had been in bondage. And they came to a point after they crossed the Red Sea where they began to complain. So we're going to look at some aspect of a spiritual Stockholm. God sent Moses to redeem his people and to take them to the promised land. There he would establish them as an example to the whole world of what a nation looks like when it submits to God and follows his ways. Or rather, that's what he would have done. So God had a plan, and that's what he wanted to happen, except Israel developed a textbook example of the Stockholm Syndrome. Exodus 5:21 kind of alludes toward this. You can read that on your own. When God began using Moses and Aaron to perform miracles that will ultimately end in Israel's freedom, Israel complained that things were just getting worse. Once they finally had freedom, and they griped every step of the way, longing for the meals that they had while they were in Egypt. They were craving the delicacies that they became familiar with and the appetites of bondage. And that's what they wanted to go back to. I want the onions and the leeks. So they conveniently forgot about the what? Lashings and the taskmasters and the enslavement. Now wait a minute now. God went through all this trouble to get them out. In fact, 10 miracles happened, and even the firstborn and the whole idea of the Passover was all of this that had occurred. And finally they're out. And they've crossed the Red Sea, and Pharaoh's army had drowned, as it were. And now they're on the very border of the promised land. And now they panicked. And in some cases, they even tried to elect another leader to return them to slavery in Egypt. They conveniently forgot about the lashings, the taskmasters, and the enslavement. All that the whole miraculous aspect of what Israel experienced had reduced to this idea of forgetfulness. What did they forget? The pain and suffering and enslavement that they experienced in Egypt. That's a type of a spiritual Stockholm. Israel didn't want freedom. They wanted to remain hostages in the hands of people who would only use them as tools. And even when the path to freedom had been clearly open and offered to them, they drugged their heels the entire way. Israel had a Stockholm Syndrome. And so, this better helps us to really understand what Israel went through. That they were undergoing, we can see the attachment theory in place. They're more wedded, to the past and the way things were. They were not ready to follow a God they couldn't see. They'd rather follow a God, small g, that they could see, which was Pharaoh. They were not ready for God to continue his miraculous involvement and intervention in their life by providing for them a whole new appetite, a whole new table, as it were. Rather, they began to long for and to crave for what they ate and what they had back there in Egypt. A lot of this, what we see here happening with Israel and the attachment theory and this whole spiritual Stockholm, can relate to things that we are encountering today. Are we witnessing a psycho-spiritual Stockholm, especially among people of faith? especially among, Christians that live in America. Attached to old paradigms of tradition that we are not ready or willing to let go of? Or are we addicted to the oppressive ways of Western empire and Americanisms that we've called and we've made to be the gospel? I call it the gospel of patriotism. Are we addicted to that? Have we adopted these approaches and embodied them in our churches? Are we witnessing people that are so used to the theological lies that we have been comfortable with, rather than challenging them in effort to free the minds of people from a system that has oppressed, especially the people of the diaspora? As we conclude this particular segment, these are questions I want us to think about. Are we addicted? Are we encountering some sort of spiritual Stockholm, to where this is the way things have always been in the church? This is the way things have always been in America. And to change that means that I am not being patriotic, or I'm not a true follower of Jesus. As we wrap up this series the next time, keep these questions in mind, because we're going to look at some examples as to how and ways in which we can see how we have had an attachment to the way things have been, and why we push back and resist and give knee-jerk to trying to change the way things have been. And we're going to break some of that down in the hopes of exposing some lies. But the truth is that if we can expose the lies, we can set people free. Come back next time for the thought-provoking conclusion on the trauma of transition. God bless you.